talk to you about the UltraShape and mostly the new advances in UltraShape, which have been considerable over the last year or two. Just at a glance, most of you are probably familiar with the technology. It's been out for several years in Canada, but this is still the only technology that provides non-invasive, immediate, selective, and permanent fat cell destruction. And those three words together, immediate, selective, and permanent, to date, I think it's still the only technology that can offer all three. It's clinically proven, safe, and effective. It's mostly used on the abdomen, flanks, and thighs. It's been the subject of up to now 7 peer-reviewed published articles and book chapters, so there's a lot of clinical and scientific evidence that this technology works. This is no longer pie in the sky. UltraShape got its CE mark in Europe in 2005. It was approved by Health Canada in 2007, and it's still in process for FDA approval. It's in use in more than 50 countries. Over 200,000 patients have been treated with it. So, you know, this is a machine that's been around and has had a lot of users and a lot of happy patients. The safety profile has been excellent. We've had one for over 3.5 years. I've had 2 blisters in my practice, and there's to date no serious adverse events reported anywhere. And the big news is the new VDF, or Vertical Dynamic Focus software, which has been released this year in 2011. It's actually built into the machine, but until Health Canada approves it fully, they can't actually turn it on. But they tell me that'll be happening in the next 2 or 3 months. So this is the old machine, or the current machine until they tweak the new software. And basically the transducer goes over the skin and delivers a focused ultrasound beam to a fixed focal point about 1.5 centimeters below the skin. This is a non-thermal focused ultrasound. There is no heat generated. The adipocytes are destroyed by cavitation or mechanical acoustic effect, so you have none of the side effects of heat. There's no pain, there's no dysesthesia, there's no bruising, there's no swelling, there's no downtime. So it's quite unique in that respect, and it's very selective. Skin, vessels, connective tissue, and nerves are not affected. This is what the new platform looks like. It's now a mobile platform. If any of you are used to the old machine, which was a big static machine that took up a whole room, this is a major advance. It's still a bulky machine, but at least it's movable. The main features, it's got a tracking and guidance camera. It has of course, the ultrasound transducer. What's new is the RF transducer. They've now combined RF with ultrasound. It has a tracking monitor and a graphic interface. What's great about this machine is it's idiot-proof. Anybody can use it. The machine is guided by its software. It's almost impossible to screw up because the software tells you where to fire the pulse, excuse me, and it won't let you fire 2 pulses on the same spot. So it's almost impossible to get an irregularity or an overtreated area. This is what the new RF transducer looks like. You can adjust it for vacuum and for the intensity of the RF. It's a bipolar RF, which basically the vacuum sucks up the skin and the fat between the bipolar electrodes, delivers the energy, which affects both skin and fat. And again, those are adjustable. So the key improvements basically of the new version 3, which was released last year, is a stronger digital ultrasound pulsar. It's the new multi-application platform, which now adds RF to the ultrasound. And they now have a new protocol, which basically consists of first pass of RF, second pass focused ultrasound, and a third pass with RF. And they've gotten more consistent and better results using this new protocol. So these are some results. Some of these are my patients, and like Julie, I'm going to qualify this. I'm a surgeon. My most common procedure is abdominoplasty. My second most common procedure is liposuction. I do a lot of those. And my first question when I see a patient who comes in for UltraShape is, have you considered surgery? And if they say, well, maybe, then we stop the UltraShape consultation right there, and it becomes a surgical consult. But as most of you know, many patients will say, no, I do not want surgery. And those are the patients, once we select them, that we go on with the UltraShape consult. So I know some of these will look like tummy tuck patients, and I agree, but some of them have, but these patients have refused surgery. So there's another of my patients, lower abdomen, with about a 4-centimeter reduction. This is obviously a tummy tuck patient who did not want surgery. She had a reasonable reduction, 6 centimeters. This is the more typical and most likely patient for UltraShape, the slimmer patient with a little bit of a pooch who just wants to flatten the muffin, basically, and will lose 2 or 3 centimeters with the UltraShape. Another heavier patient with a reasonable reduction. This is a patient of Dr. Thompson with a 10-centimeter reduction. a patient of Dr. Tink with a 5-centimeter reduction and a very impressive 14-centimeter reduction on the flanks on this patient. So it works. Like Julie said, you have to select your patients correctly, set their expectations. It is not liposuction. It will never replace liposuction, but it is an alternative for that non-surgical patient. And like Julie, by the way, it will increase your liposuction and abdominoplasty patients. So my experience with the new version 3, I had the original UltraShape since 2007. I got the version 3 last year. We've treated over 100 patients with it so far. It's been very well tolerated. The average circumferential loss with the 3-treatment protocol has been a little over 4 centimeters, but what's impressive with the new version 3 is, and I presented this last year at the class meeting, is we looked at our first 15 patients, and every one of them lost at least 2.5 centimeters. So what we're finding with the version 3 is we're getting far fewer non-responders or poor responders and much more consistent results with a high patient satisfaction. So the new thing now is the VDF, the vertical dynamic focus, which, as I mentioned, is software that's already built into the machine. Currently, all that software will allow you to do is use that same unifocal transducer, but with 25% more power. But in a few months, they'll be able to turn on the software, where the most interesting part will be that you can now treat multiple depths, not just one focus point, but 3 focus points below the skin. So on the top is the current machine with the single focal point, but now 25% stronger. The bottom is the new multi-focus software, which again is not turned on yet. It's still awaiting regulatory approval. We got one of the beta machines 2 weeks ago, where we just got it, so I can't tell you too much about it. We've just turned on the software ourselves, and we're treating our first patients with it. But what this allows you to do is, instead of treating one focal point, you can now treat at 3 different levels at 7, 10, and 15 millimeters with one pulse. So this is what it looks like schematically. Your technician can now choose the depth, so she can treat a patient with 3 different levels with one pulse, or 2 different levels depending on whether the patient has a thicker or thinner pannus. And you can even do now what's called the super mode, which is a double pass, which is a computerized pattern which allows you to do the first pass with maximum peak pressure over the entire zone, and then select a second zone within that first zone at 50, 80, or 30%, to do a second pass at maximum peak pressure at a more superficial level. So this, in fact, is the equivalent of feathering with liposuction. And this is what it looks like schematically. On the left is the current transducer with a unifocal focus point. On the right is the triple focus point, and you can see a much larger path of destruction through the adipocytes. This is what it looks like in ultrasound gel, and again on the left, the unifocal point. On the right, the new multifocal points, much larger path of destruction. And this is what it looks like in the pork fat. On the left, the control. The middle one is the current unifocal transducer, and you can see the much more efficient fat destruction with the multifocal transducer. So what does it look like clinically? This is a study done by Dr. Leal Silva in Mexico. He looked at 15 patients with the new multifocus software, and these are some of his patients. And if you look on the right, you'll see the morphing of the result, and you can see a nice reduction there. Another patient, again, if you look on the right, you'll see the morphing of the result. And nice reduction. These are all 3 treatment protocols with the new multifocus software. And again, on the right, and you can see a nice reduction as well. So in summary, the new version 3, again, is currently the only technology that will give you immediate, selective, and permanent fat cell destruction. You can see results as early as 2 weeks compared to some of the other technologies. There's minimal discomfort. There's absolutely no need for sedation or anesthetic, as again compared to some of the other technologies. The tracking system is idiot-proof. It's almost impossible to overtreat or to get irregularities. There's no downtime. There's no bruising. There's no swelling. There's no dysesthesia. There's no garment. So it really is an outpatient or no downtime procedure. The treatment times are much shorter than some of the other technologies. It can be as short as an hour depending on the area. Again, the time to see treatments is short. It's about 2 weeks. And with the new RF, you're getting better results and maybe some skin tightening at the same time in the same session. It efficiently treats the abdomen, flanks, and thighs. They're working on new transducers, so hopefully eventually we'll be able to treat arms, calves, necks, and other body areas. The consumable costs are quite low compared to other competing technologies. And the new VDF multifocus, I think, sets the bar even higher, because we can now treat a much thicker path of a much thicker layer of fat and actually tune it to the patient's pannus. So I've had the UltraShape for 3.5 years. I'm very pleased with it. Again, it's not going to replace any of my surgical techniques, but it is an excellent alternative for that non-surgical patient. Thank you.